Okay. So telenursing refers to the use of telecommunications and information technology for providing nursing services in healthcare to enhance care whenever a physical distance exists between a patient and a nurse. All right, sorry. The most developing area of telenursing today is home telehealth care. There's more than 90% of seniors who want to stay independent in their home, and care at home is clearly a key concern and preference. And also, I depend on home health nurses to take care of my patients when they're not seeing me. They're not sick enough to be in the hospital, but they definitely need more monitoring than I can give them at a doctor's office. So the home care industry's newest challenge is to work with sicker patients, many of whom have been discharged from hospitals earlier than they used to be. So home care telenursing can also involve other activities such as providing customized patient education. The education is a big part in diet or exercise needs, nursing teleconsultations, review of medical records and exams, and assistance to providers in the implementation of medical treatment protocol. Here's a great example. Someone with diabetes. So look, it used to be, even if you were a type 1, so you have really high blood sugar, but you're stable, okay? They're gonna let you home from the hospital. It used to be they would admit you, get your blood sugar down, and then discharge you. They don't do that anymore. They're like, follow up with your PCP. Great. They follow up with their PCP. Person's blood sugar is still running in the 400s. I got to titrate up their insulin slowly. So they can't come and see me every day. A, I don't have the room, and B, that gets expensive for them. So what do? We have nurses go out there, or nurses who call them and say, what was your blood sugar today? Okay, based on that, you're going to go up on this with your Lantus, but what are you eating? How are you feeling? Are you having any chest pain? Are you peeing a lot? Oh, you know what? Maybe I need to send a nurse out there to check for ketones in your urine. Again, the patient can avoid going back and forth from the provider's office, and they're still getting really good treatment. So home care telenurses can well expect to play a vital and dynamic role in changing delivery system, and that happens all the time. So patient populations, those who are homebound, limited access to transportation, lack of primary care and emergency resources. It's a strategy to reduce hospital length of stay or managing patients in major disaster or large-scale nuclear attack. Oh boy, well hopefully we won't have to deal with that one too much. All right, so chronic disease patients. So chronic disease, people have high risk of acute episodes for subtle changes like their weight. That's a big one. CHF has been using telehealth forever. When people plug their scale into the phone line and it directly reaches their case manager. COPD, diabetes, and wound care is a way, excuse me, that they're utilizing telemedicine. Elder care telehealth in assisted living facilities or subacute care centers have a kiosk that can be used to obtain vital signs for large groups of people. Vital sign reports can be forwarded on to regularly established schedule to physicians and other involved in patients' care. They do telehealth is great with wellness programs because they can monitor options like reduce absenteeism and increase productivity, lower healthcare costs, and create financial incentives. So tools for telehealth. You need central stations and web servers that are key components to telehealth so that you can quickly reach the patient. You can have as minimal as one screen, or it can be very comprehensive with various functions. I've even seen telehealth where you can look in someone's ears from the comfort of your own home. Peripheral biometric devices can consist of fully integrated systems, like being able to check someone's vital signs and blood glucose, to just being able to see them. Telephones are already the most familiar way we do it. A telephone device can be augmented so that it's easier for the patient to use. Video cameras and video phones are easily available to the consumer, so that's really important. The only thing now is we have to watch for our privacy. Personal emergency response systems, so I've fallen and I can't get up. That's a form of telehealth medicine. Sensor and activity monitoring can track activities of daily living. Medication management devices are addressing a well-recognized major problem with compliance. So I actually just did a study, like a review. I didn't actually perform a study, where they're able to connect a Mediset to the patient's doctor's office and their case manager, and they're able to figure out if their patient was taking their blood pressure medicine, because when the pills were taken, it beeped, and it's a very complicated Mediset. But the point was, it increased compliance and increased outcomes. So, and then it allows creation of digital health records. So the information is recorded over time. Trend information can be developed so that you can have better population-based analysis of interventions. And then you can set acceptable range of values for individual patients when they enroll in a program. So, for example, I do it with home health. If the blood sugar is this high, you call me no matter what. If it's not, you perform interventions based on a protocol to help the patient out. There's some pretty crazy and advanced telemonitoring software out there. Readings from multiple pieces of equipment on a single patient can calculate risk of an acute episode. There's sophisticated protocols that we can develop now for routine and alert information. And from that information, we can decide if someone needs further care or if they are safe to stay at home. Home telehealth programs are different, right? Depends on what you need, the type of technology. You need to get consent, and you have to ensure focused work with patients and allow for targeted intervention. Now, this isn't a crux. Like, we're not going to stop seeing our providers. If something's really crazy or you're bleeding out, you need to go, and see someone. But this helps for kind of those nuanced visits that you can't have with everybody. It allows for more efficient and effective clinical management. One of the issues with telehealth is obviously billing. You can't always bill for them, and that's where, if you're going to invest in all this technology, obviously outcomes, when they improve, you get more money, so that's helpful. But sometimes it's hard. When I was first struggling to build my panel, I didn't send tons of nurses out to go see my patients because I needed them to come back so I could see more patients. And I know it sounds bad, but it wasn't that I wanted to see them for more money. It was that I might as well see them. I have the room on my schedule. But that's still charge the patient. But also, it takes work to run telehealth medicine, and you have to be reimbursed for it. So this talks about the legal, so policies and procedures. So you need to talk about enrollment, education, and home assessment and setup. Patient-informed consent and privacy. So important. And the plan of care has to be specific to the patient's needs, and the patient needs to be realistic for what they can expect. Nurses must be licensed to practice in all the states that they provide telehealth. Scope of practice and accountability has to be defined. So scope of practice changes within nurses and nurse practitioners, and that's important. You have to be vigilant about keeping really extensive documentation of their visit on and off the site. Confidentiality and privacy, so huge, so huge. So everyone involved, including the technical staff. So think about it. You're going to have IT support, and they might see your patient. That is going to involve privacy issues. So the patient has to be aware, and you have to make sure that you're protecting the patient. Think about patient use consideration. So like my mom might not be great at turning on the computer and doing this. So you got to make it easy for that. So there has to be usability testing ongoing and all the time. Ethical design principles. So how provider or patient-centric is the technology? Does the shift to remote service promote rationale and efficiency at the expense of the values at the heart of caregiving? Putting your hands on a patient is really important. So are you just robbing Peter to pay Paul, or is this just adjuvant to improve patient care? How does the design affect home life and family dynamics? To what extent should technology usage involve? How might the replacement of human contact affect healthcare? And to what extent is the deployment of technology an end in itself? Are we doing it just to improve technology, or are we trying to help other people? And then how do we identify the boundaries between genuine solution and futility in light of technology that can shift them? So is this a genuine solution that's going to help, or is it like kind of a solution because there's nothing else we can do? And then are we just doing it for technology's sake? So the model for telehealth, the knowledge model. So knowledge acquisition involves the nurses receiving the information from the telehealth device via a variety of communication modes. Knowledge processing is understanding a set of information in ways that can be useful to a specific task. So after processing the information, the nurse is able to target the appropriate next steps involving knowledge generation. And the nurse considers all the data as it applies to the patient and decides what the next course of action should be.